Do you think it's okay to use a prokinetic in someone on these medicines who are getting symptoms where they would need a prokinetic? So just for people listening, prokinetic is an agent that can help move the stomach and intestines in a downward motion. And these drugs stop a lot of that. They slow that. That's part of their mechanism of action. But yet, is it okay to do that if they're having really bad symptoms?
Yeah, so first of all, if a prokinetic like Prucalopride would do what we want it to do in the GLP-1 patient, it would overcome the GLP-1 and then be counterproductive to the effect of the GLP-1. So patients probably wouldn't want that anyways, because they're buying an expensive drug to lose weight, and the Prucalopride or the prokinetic is counteracting that. But I can tell you that the GLP-1 agonists are so powerful at inhibiting motility, nothing overcomes it. You can take all the Motegrity or Prucalopride in the world or Prokinetics, it's not going to overcome the power of the GLP-1. So it's a waste. You're wasting money taking it.
Wow. And have you seen many people with SIBO get worse on these? I mean, obviously that's a concern. Have you seen it?
Yeah, so I see. So the problem is, again, it's confusing because what I see are patients who go on the GLP-1. I had one yesterday, actually, literally in my clinic, and she wanted to know if she could check for SIBO because she feels like the SIBO is starting to come back. She's on the GLP-1. She's successfully losing weight, but and I said, no, I mean, look, you have to decide what weight loss you want. And when you get to that goal, we pause the GLP-1 for a period of time and check. But to say that what happens with the GLP-1 is that people just aren't eating much because they have no appetite. So that reduction in calories usually means that their IBS symptoms are less because they're just eating less. So they're probably fermenting less. Does it reduce the overgrowth? I don't know, as I said earlier, but they're fermenting less because they're eating less. So their symptoms generally don't get worse on the GLP-1, maybe slightly better, but again, I'm just imagining what's happening. I don't have any objective evidence.